Medical Dilemma.
Welcome back to Medical Dilemma. Again, we'd like to say thank you to our major sponsors, St. Clair's Medical Center and LifeQuest Training and Consultancy Corporation. Now, to start off the third segment of our show, maybe let's focus on what happens after a heart attack. And I think, Dr. Sanchez, you have a question about that.
I think the audience would like to know, supposing you have a heart attack, whether it's mild or massive, how long do you keep the patient in the hospital or before they can really go out again and resume their activities? And then later on, pag post-op naman, inoperahan sa puso.
Pag naoperahan, yes. Again, like you said, it can come in several degrees. It can be mild, moderate, severe. It can be complicated, not complicated. So marami ring factors na tinitingnan yung specialist attending to the patient kung how long the patient should stay. Number one, sa coronary care unit. Yung coronary care unit is really equipped, parang intensive care unit, equipped yun para mabantayang maigi yung pasyente so that any complication can be quickly picked up and promptly treated. No? So kung uncomplicated naman, uncomplicated cases, usually the patient stays mga 2 to 3 days in the coronary care unit and then may step down yung telemetry rooms. No? We keep them there another 1 to 2 days and then sa labas na another 2 to 3 days.
Because, Doc, in the telemetry room, what is being done, that's a little different from the ICU.
Yes. Parang in between ito, intermediate. So parang nasa kwarto na rin yung pasyente, nasa private room. So kasama na niya yung kanyang mga pamilya, mga bantay, but nakamonitor pa rin yung pasyente. So at least that really gives us an idea if the patient is already stable or not. Because as we very well know, patients with a heart attack, they're prone to yung irregular heartbeat, arrhythmia, we call, which may be pasumpong-sumpong lang, paroxysmal. No? So ECG mo yan, wala kang makitang arrhythmia. Pero sometime during the day, nagkakarbigla na lang, nagkukuhan, yung pala nagkaroon na ng life-threatening arrhythmia. So habang nasa telemetry, so that affords the healthcare professionals, especially the ones attending to the patient, yung monitoring parameters. So nadidetermine niya if the patient is really stable already electrically, that's wala ng arrhythmia. No? Pag talagang wala na, with minimal physical activities, then the patient is brought back to the room. Now, kung ideally, the patient should undergo cardiac rehabilitation. Para bang yung mga nagkaka-stroke, no? Pagkuhan, meron ni-rehabilitate sila with some exercises. And ideally, we should do that in all patients developing a heart attack, particularly the more complicated ones. But kasi it's an additional expense. So minsan ibang pasyente nagkukan, Dok, wag na lang muna yan, parang kwan, so that we can go home immediately.
But when you say cardiac rehab, exactly what is being done to the patient? Anong talagang ginagawa ng pasyente doon?
Yung cardiac rehab, the patient is given a series of exercises, progressive exercises, just to make sure that the patient can already tolerate these exercises without any harm or complication to the heart. Because yun ang problema. Minsan heart attack patient, we keep them in the hospital for several days. Bed rest sila, naka-bed rest lang. Pag umuwi yan, siyempre maglalakad-lakad na yan. They'll do something else. Yung maring they might resume sex with a spouse. We want to get a good, at least a fair estimate of what happens to the patient's heart the moment he or she resumes their physical activity. And this is being more or less assessed through cardiac rehabilitation. No?
So iba-iba rin per patient? Is it or more or less the same?
More or less, we have a protocol kung ano yung from day one hanggang sa makalabas ang pasyente. But modify natin to depending on the capability of the patient, on the severity of the heart attack. Kung may heart failure, siyempre, medyo hinay-hinay lang. Pumapalya yung puso We go slow. Pero kung complicated, medyo mas mabilis-bilis ng konti. The bottom line is that when we send the patient home, we want to be assured that the patient's heart is already stable, and there's no risk of developing another heart attack weeks after the first heart attack, and the patient can already at least resume activities of daily living, no? Makakapagsipilyo na, wash his face, take a bath, no? Kumain, walk inside the house several minutes a day. So at least yung mga ordinary activity malang na kaya na ng pasyente. Then the patient is, again, follows up so that we can progressively increase the patient's activity. Sabihin natin, sige, gradually increase your walking up to 1 hour, no? Depende sa kaya. And then a repeat treadmill test may be done to really assess kung hanggang saan ang kakayanan ng pasyente. Yung treadmill test nga, hindi naman yung todong-todong. Yes. Baka maka-heart attack lalo. Yung lang.
So, Doctor,
we use a specific protocol para ma-assess lang kung kaya na ng pasyente to resume a more active lifestyle and possibly go back to work.
So if this patient religiously does all these things, how low do the chances of a second heart attack go?
It will not be low. Depende kasi sa overall cardiovascular risk of the patient, no? So, but having had one heart attack, kumbaga sa grabe na kagad ang patong ng cardiovascular risk noon, no? Lalong dumoble na, no, ang risk noon, no? So it will not really get lower, but at least we can still reduce the overall risk of developing another heart attack, because definitely the risk of having a second heart attack, particularly in diabetics, yung mga may diabetes, ay nako, it increases 3-4-fold after the first heart attack. Pag may diabetes ka, mas mataas yan. Yes. Kaya yun ang kuha natin. Kaya we're more aggressive in controlling all the risk factors. So we're not only treating the heart attack per se, we have to identify all the risk factors na nakapag-contribute to the development of the heart attack. May diabetes, kontrolin natin diabetes. Mataas ang presyon, kontrolin yon. Yung cholesterol pababaid, kahit na nga normal ang cholesterol, we give drugs for cholesterol. Kaya yung minsan nagtatakang pa siya, Dok, normal naman cholesterol ko. Hindi, kahit normal, kailangan bigyan pa rin, we call the drug statins, no? Para talagang mapababa pa yung cholesterol level niya and masiguro na hindi magkakaroon ng mga deposit ng mga taba, ng cholesterol roon sa artery ng pasyente. So, really aggressive intervention in the patient who had a heart attack. Kung kakailanganin, kung meron pang ibang artery na barado, that's the time we resort to angioplasty. Tapos naglalagay ng what we call stent, parang pangkalso, parang scaffolding. Yes, lumaki yung artery. So,
other than the cholesterol, diabetes, and some other risk factors, are there other things that the patient should be cautious about? Let's say nutrition, or let's say sex, or whatever. Can you explain to us, Doctor, about those things?
Unahin po natin yung sex, Father Jerry, kasi yan ang palaging tinatanong, lalo ng mga kalalakihan na develop na heart attack. Yung minsan palalabasin pa si Mrs. muna. Biglang sasabihin, Dok, okay lang. Nahihiya rin. Yun nga, it doesn't mean, number one, hindi totoo yung impression ng iba. Pag nagka-heart attack na, bawal na yan. Baka magka-heart attack
limited
na.
ng ibang activities.
Hindi totoo yun. Basta stable na ang pasyente, hindi na nagkakaroon ng chest pain. Ang basehan nga namin, tinatanong namin palagi, nakakaakyat ka na ba, akyat panawag sa hagdanan na hindi nakakaramdam ng kahit na anong simptoma, walang chest pains, hapo. If you can manage one flight of stairs, no, up and down, then more or less yun ang equivalent ng normal sex. Huwag naman yung acrobatic sex. yung normal sex.
Baka ma-fracture
another yung normal sex with the spouse, no? With the regular spouse,
regular
stress,
partner. Kung ibang partner,
pag iba,
kilala.
Ay, grabe ang stress noon, masama sa puso, no? So, if one can do can go up and down the stairs, kayang-kaya na yung normal sex, no? So pwede na 'yan. Pwede nang i-resume 'yon, no? Pero pag nagche-chest pain pa, medyo may hingal pa, hapo pa, medyo
Hindi pa pwede.
paghintay-hintay na muna. May tamang panahon.
Okay.
So,
Sa tamang panahon.
Sa tamang panahon. Right.
yung
Doctor,
yes.
if let's say a patient has been advised that he or she has to get bypass surgery, can the patient refuse that?
The patient makes a final decision. It's not the doctor who makes the decision. We only make the recommendation. We explain to the patients the various options that can be taken. But at the end of the day, it's the patient who makes the decision. Of course, we'd like to make it a joint decision
Yes.
by the doctor and the patient, parang joint decision. But by and large, actually, yung pasyente ang magdideside talaga. Ha? Kasi, alang namang, yung pasyente ang katawan niya, ang
Yes.
Right.
isasalang niya sa operation, no? Siya ang magbabayad, or the family niya magbabayad ng cost of operation. So, siya ang dapat na mag-decide talaga.
Yeah,
But
well, in
Yes,
fact,
Father.
ethically, the patient is the first person,
Right.
has the first responsibility for his health. He should be the one to take the decision, final decision, in coordination with his trusted doctor, for that matter.
yeah.
I see.
Ang gusto lang ng doktor is to empower the patient to make an informed,
Right.
intelligent decision. Not to give him all the information that he needs to be able to make an intelligent decision for himself.
Now, I read in some publications in the U.S. that bypass surgery is probably not already relevant to the practice of, controlling heart diseases or curing heart diseases because of emerging technologies, like nanotechnology, laser technology, I guess. Do you see that happening soon?
I'm not a cardiovascular surgeon, but I will side with a cardiovascular surgeon in arguing with any writer who would have that kind of position. No, no, I think cardiovascular surgery will always be relevant. But of course, it's relevant for the right indication. There should be specific indications. It should not also be abused. No, dati basta may bara sa artery, ino-opera na kagad,
Right.
bypass. Now, kung karamihan sa mga minor na bara na isang ugat lang, single or double vessel disease, or sometimes even triple vessel disease, basta hindi komplikado, kaya nang i-angioplasty, hindi na kailangan operahan. So, in that sense, nababawasan the need to do heart surgery. But there are still indications for heart surgery
You
which
really
will
need.
remain. I don't see any advances in medical technology, or not even in nanotechnology, that will make surgery irrelevant for these indications.
I see. Okay, well, I think we've reached the end of our segment, so maybe we can have some parting words from our host. Not yet? Okay, so I guess we still have more time for a few more questions.
I want to ask about aneurysm, di ba? Sabi nila yung mga aneurysm, it is congenital now. But I have the theory, and I think some agree with me, that sometimes it's due to hypertension that is uncontrolled or pa-sipot-sipot, and so they weaken the heart, the walls,
Right.
and then you have an aneurysm. Can you comment on
Yes.
that?
One may have a genetic predisposition to a weakening of the artery. So one is not born with an aneurysm already. Yeah, one may be born with that disposition na medyo weakened, medyo mahina yung muscles of the artery supporting it. And as one grows old, with risk factors like hypertension, sometimes with trauma, with accidents, for example, then just imagine yung lobo, hinihip, pag nag-blow ka, if you blow through yung balloon, nag-expand.
Yes.
So that is exactly what happens to an aneurysm. But again, majority of aneurysms that we see in adult patients, then they have risk factors, and hypertension is definitely one of them. So that destroys the lining of the internal artery, yung endothelial layer we call, no? May mga several layers yung lining ng arteries. And when these layers are weakened, then that makes the artery prone to develop aneurysm. So sa hypertension, usually sa aorta, the main artery which can start from the chest, sa thorax, no? all the way down to sa abdomen, abdominal aortic aneurysm. But we can also have aneurysm rin sa brain.
The brain.
No? Diba yung mga kwan. And sa brain, kahit ng maliit na aneurysm, significant na yon.
So that's it.
I see. And if you have an aneurysm in the brain, what are the chances of surviving that?
Ay, pag na-detect naman early, if it's
Pwede
detected
operahan.
early before it ruptures, then the prognosis or the overall outlook is very good. And in many instances, surgery is not even necessary to deal with the aneurysm. So meron na ngayon, invasive pa rin, but just through the arteries, yung endovascular coiling, we call coiling. Kino-coil lang nila yan, parang ipa-plug nila yung aneurysm na sa brain. And we've had quite a good number of patients who underwent endovascular coiling for their aneurysm, and they're doing very well. Sometimes nagre-recur. In a few instances, they recur, and then you have to do another coiling, or that's the time you subject them to surgery. But in the majority of cases, they do well for many, many years.
I see. Okay, well, we have reached the real end of our segment, and sorry for that earlier blooper. So any parting words from our host and our guest? Okay, Attorney Sara first.
Yes, I think what we'll take home from this discussion is that medically, ethically, and legally, the patient has the last say when it comes to his or her care.
Yes. Okay. Thank you so much, Attorney Sara. Okay, Dr. Castillo.
Well, yeah, we only have one heart. We don't have a spare heart, so we have to make sure that we take good care of our heart. And as we pointed out and emphasized earlier, a healthy lifestyle is really important to make sure that we don't develop heart problems.
Okay, thank you so much, Dr. Castillo. Father Jerry?
Well, we know very well that the heart is the very core of our existence, no? The basic role of the heart is to take in or receive, pump in blood or oxygen, but it has to also to send it out, to pump it out. Otherwise, if there is a breakage in the two, then there is where the heart disease. And metaphorically, the more the heart receives love, the more it has to give love. So take care of your heart.
Very well placed, Father. Okay, Attorney Sara, Attorney Sanchez. Sorry.
Well, kasi attorney rin. No, first of all, I'd like to
Sara,
thank our
attorney.
guest. We're very happy. He's a well-known cardiologist, and we could learn a lot from him. But in
pleasure.
passing, just deviating a little bit, I got word when you said when it's your specialty, you can die from it. So take care of your heart also, doctor.
Yes, I will.
And
Yeah,
so with
and
me,
I
I'll
am.
take care of vascular
You also
accidents
have-
and all of those
Right.
things. Kasi
But
medical legal.
Dr. Castillo also has an advantage. He can cure himself, I suppose.
Of course.
But kumisan, I forget.
You know, doctors make the worst patients. We should not treat ourselves.
All right. Okay, so dear friends, take care of your heart and take care of the affairs of your heart. As Oscar Wilde wrote, keep love in your heart. A life without it is like a sunless garden when the flowers are dead. Thank you for watching this episode of Medical Dilemma. Watch us again next Sunday at 6 p.m. here on GMN. You can also catch us every Monday from 11 a.m. to 12 noon on this same channel. Help patients and families in crisis. Be aware and show you care. Have a productive week ahead of you.
Medical Dilemma.